everybody, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to be talking about rheumatoid arthritis. 1% of the global population has this condition and 75% of them are women. Not many know about this because women are more prone to autoimmune diseases. So to talk about this condition, we have with us Dr. Sushant, and we have these two wonderful women. We have Rachita and we have Nisha. So let's start by understanding this condition. Dr. Sushant, why don't we talk about what exactly is rheumatoid arthritis in very layman terms?
Any disease of the joint is what we would call arthritis.
Correct.
A disease of the joint can occur in two broad strokes. First is what most people are aware of. People are aware that when they age, joints are going to pain. Typically that is going to be the knee joint. Right. Now that, if it is happening in someone who is elderly, usually 55, 60 above, someone who is obese, someone who had a past injury, that is osteoarthritis.
Got it.
The commonest arthritis because of age, wear and tear. But there is a second big group, and that second big group is what we are talking about, which is called inflammatory arthritis. Okay. Now, inflammatory arthritis could occur at any age. It could start at the age as low as 2 years.
Oh, 2 years.
And most of the people who suffer from inflammatory arthritis are in their teen ages. Between 20 to 40 is when most people start developing it.
Got it.
And the commonest form of inflammatory arthritis is rheumatoid arthritis.
Okay.
If I explain in short what is inflammation, if I just convert that medical term into layman English, उसका मतलब है आग लगना हिंदी में.
Correct.
So it's almost like the joint is inflamed, which means the joint has an internal injury. It's not an injury which has come from outside.
Okay.
It is a genetically determined injury. Due to some environmental factors, it's progressing, but the injury is in the joint. Okay. And that is causing the joint to swell up. It is causing the joint to be painful. It is causing stiffness in that joint. So people are going to have difficulty in using that joint.
Correct.
The joint could look red. And if we allow that inflammation to progress, it can damage the joint permanently, leading to deformities.
Understood.
And the commonest cause of such a thing world over is rheumatoid arthritis.
Got it. And what are the causes? And is genetics, does that have to play a big role in getting this condition?
What we can say is definitely genetics plays a significant role. Now, I would like to add over here, when we use the word genetics, we do not mean hereditary. I do not mean to say that it would go from a mother to her child. Okay. That is not always.
That's important to clarify.
Yeah. It is genetic, which means there are genetic markers which we have been able to identify, which predispose certain individuals, but they wouldn't necessarily go from one generation to another.
Understood.
However, that said, there are going to be very often patients in the same family, in the extended family. So someone might have an aunt having it, someone might have a nephew having it, something not necessarily the direct vertical family.
Right.
Second, there could be environmental factors which trigger it. One of the definite known environmental factor is smoke exposure. Okay. There is work done from All India Institute, AIIMS, Delhi, in India, which has shown that the level of pollution in the city also has a role to play.
Okay.
A lot of our patients tell us that when they go back to their native places, they do much better. They go out of a city like Bombay or a polluted city, they start feeling better, but when they come back, the pain aggravates.
Got it.
So smoking, direct or passive, environmental pollution, these are known factors. Weather changes are known to trigger. A lot of people feel worse when the weather changes from, let's say, monsoons begin or the winters begin, people start experiencing more pain.
Okay.
Similarly, emotional stress also is known to trigger pain for a lot of people. Here I would like to clarify, there's a big myth around this that probably diet is doing it. Whatever research we have till date does not support that hypothesis. There is no concrete evidence to say that a certain type of diet has caused it or that person should avoid eating something. A lot of people think khatta khane se hota hai. Probably someone might have it. It's probably some people might have it, but I can't advise that to everyone. So it's not necessary that people stop eating what they were eating. Food doesn't seem to be the cause for rheumatoid arthritis.
Understood.
Since we are talking about women health, one big factor is pregnancy and the period after pregnancy. Okay. Post-delivery, a lot of women realize that they have arthritis the first time over there. And again, there are a lot of myths around that area, but really speaking, the hormonal changes which are going to occur, they seem to trigger patients into developing arthritis. The onset might be at that time when they have delivered a baby, and the 6 months after delivery, that's the time when a lot of people come to us.
Oh, that's interesting. And again, talking about the symptoms, because that's what you just spoke about, is there always pain and stiffness and swelling, and are these the three symptoms that you'd think through in your joints and realize, okay, maybe I should go get myself checked?
When we come in inflammatory arthritis, there are a lot of subtypes. Rheumatoid arthritis will be detected in a person who would complain of pain, especially in the hands. It starts typically in the hand joints.
your hand
And it's not one joint, it's multiple joints. So a lot of times, when it begins, people are not able to realize that it's a joint pain. They feel everything is paining, right? Along with that, they experience morning stiffness. When they wake up in the morning, for the first half an hour to 45 minutes, they would find it difficult to make a fist. A lot of people tell us that they would warm up their hands or use some form of massage or something so that the hands become a little loose. So morning stiffness, involvement of the hands and the finger joints, they are going to swell up, they are going to be tender if I press them, they would look red. So these are the features to look out for in the initial stages. But as it progresses over a span of maybe 6 months to a year, it can start involving many other joints. So it can progress from here to involve the wrist, the shoulders, elbows, knees, ankle. Thankfully, and very specifically for us in diagnosis, does not involve the spine. So people don't have backaches because of rheumatoid, but they do have what we call the peripheral joints. Those are the ones which get involved.
When a patient comes to you and then you start treating them, is it possible that it started with their hands, they came to you early, and with the right medication, maybe physiotherapy, they can make sure that it doesn't progress to the other joints? Or that's almost inevitable that from the hands, no matter what the treatment, medication, it is going to go to the other joints eventually?
The word rheumatoid, the word rheuma means flowing in the blood.
Okay.
So it was an old thought. Of course, now we don't think like that. But in the olden times, when we were just understanding this disease, we used to think that this is a disease which will flow through the blood. So in the diagnosis, we have a lot of blood tests which will help us to diagnose. Rather than doing X-rays and MRIs, which might help in the advanced stages, the early diagnosis is picked up in the blood.
What do you look for in the blood?
Again, we are looking for markers of inflammation, and there are two big markers that we are looking out for. One is erythrocyte sedimentation rate, which in short is called ESR, and a protein called C-reactive protein, both of which will climb up if a person has inflammation. Now, again, I should say it very clearly, these are not markers of only rheumatoid inflammation. Any other inflammation would also have them going up. And along with that, there are two tests which are, a lot of people know about them. Rheumatoid factor is one test, and anti-CCP, which is again an antibody, which we look out for.
And both of these others are also blood tests?
These are also blood tests, and you can find them in patients having rheumatoid arthritis. However, now this is a big however, tests can be negative and the patient can still have rheumatoid arthritis. That is called seronegative. Sero means blood, it's not there. So seronegative rheumatoid is also an established entity. So the patient meeting the doctor early in the disease is paramount. We should not make a mistake that the blood test was negative, so the patient was denied therapy. The patient should still be treated. And coming to the next part of your question, can we stop it from spreading? The answer is in 2022, absolutely yes. We can stop it. You asked me this question.
If it is detected early.
Yes, we are talking about someone detected early. So when I say early, I mean the first 6 months. If a person is detected and started on therapy in the first 6 months of their diagnosis or the onset of symptoms, we are in a stage where we would be able to stop it. I cannot say that we can stop it in everybody. Yet we have reasonable better cure available, better treatments available, where the treatments, if started in time, we can halt the progression of the disease and make the patient symptom free over a period of time.
Got it. Now this is very important to understand. And then coming to the question of what is the quality of life? Is it always very painful, and is the longevity or the lifespan impacted by this?
So I would say if we are on the right kind of treatment, for most patients, the pain will come down, the stiffness will come down. Our treatments are slow. We have to admit that there are faster treatments available now, but still, majority of the treatments which we use are slow. It is going to be a time-consuming process. I tell my patients, don't count this disease in days, weeks or months, count it in years. And over a span of years, if you ask me, eventually, yes, we will be able to conquer it and bring down the inflammation. But that time is not always predictable. It could range from as low as 6 months for someone to get under control to as much as 4 to 5 years for someone to get under control. And that depends on many other factors which your rheumatologist can decide based on your particular case.
Right.
But yes, there would come a day where we will be able to stop the pain. There would come a day when we will be able to stop or halt the deformities which are happening, and a good quality of life can be restored in majority of cases. All of this depends on how early we start our therapy. The earlier we start, the better it is. Longevity, I would say, in most cases is not affected. But we have to remember, rheumatoid, as I said, खून में फैलता है. So it's not a disease only of the joints. In some patients, and it could range from 10 to 40% depending on which organ we are talking about, But this rheumatoid can cause inflammation in other organs as well.
Okay.
Typically, the inflammation could be in the eyes. Some patients could have it in the skin, and a certain section could have inflammation in the lung, what is called interstitial lung disease, ILD.
Okay.
Now, that segment, if a patient has involvement of the lung, that can affect longevity. But again, that is a very small fraction. For most cases, longevity is not affected. And quality of life, as I said, early treatment, continuous treatment, we can achieve a very good quality of life.
Fantastic. And the deformity that you spoke about, at what point does that happen in terms of, we see the fingers getting impacted, and is it because the patient got diagnosed very late, started the treatment very late? What percent of people diagnosed have deformities at some point?
So I would say in India, I practice in Mumbai. Nowadays we are finding people coming to us very early. If a person comes to me within the first 6 months, not me, any rheumatologist within the first 6 months, I would say there is a good chance we will be able to prevent deformities from ever occurring.
Okay.
Right? In a good number of patients, right? However, a lot of patients, especially few generations older, therapies were not this good, maybe
Correct.
20 years back. They come to us with deformities already developed. Now, we don't have abilities to correct those deformities except for few joints like the knees, which could be operated.
Correct.
Hand deformities cannot be corrected. Amongst the tests, I said one test was anti-CCP.
Yes.
Now, if that test is positive, that helps us to predict that that particular patient has a higher risk of deformities. So, I would be more aggressive in monitoring and treating that patient if anti-CCP is positive. So, we have some markers which help us to predict. But by and far, I'll say the best protection against the deformity is to be on continuous therapy. The patient should not stop therapy just because the pain went away. A long-term compliance is very important. We would be able to then prevent deformity.
So is this something the medication you have to take lifelong?
Answer is not for everyone. For majority people, we would be able to taper down the medicines to very, very low amount, maybe something like 1 tablet a week, and at some point, hopefully stop it. Okay. My problem is I can't predict when will I be able to stop it.
So it's very patient to patient specific.
It's very patient to patient specific, and it also depends on the compliance for 5 years, 7 years. So anything less than 5 years is unlikely because most patients don't come to us very early. So in my practice, I would say 5 years definite therapy, 5 to 7 years if you have come pretty late. But by that time, we might be able to bring down your medicines to very bare minimum, maybe just 1 medicine in a week, and hopefully even stop that.
Understood.
But it's a very, very slow process. I always feel that depends a lot between the trust between the patient and her treating doctor.
Correct.
And how it has to be a mutual plan, how to bring it down and see to it that the disease is stopped and take off the drug gradually.
Got it. And I'd love to move on to our lovely women here. So why don't we start with you, Rachita? Tell us about your story.
I think I was in the final year of my bachelor's. While we have these events in our colleges, dances are cultural events, and dance has my heart. So I always keep taking part in such events. So that's when I started experiencing pain in my knees at first.
Okay.
Initially, of course, just as a human nature, I thought it would be just maybe due to overexertion. So I just ignored, I took some painkillers and I was fine. But again, the pain kept coming back. I visited my family doctor for the first time. He checked my knees. He found it all okay, all normal. That's when he prescribed a very normal course for around a week maybe. And I was fine. But again, when I danced, the pain kept coming back. Okay. So that's when again I visited my family doctor. And he told me to get some tests done, some blood tests done. Like doctor mentioned, he was suspecting it to be gout or maybe rheumatoid arthritis. So he wanted me to get tested for these blood for these tests. So that's when the rheumatoid factor was slightly positive in my case, and that was a little scary for me as I did not expect something like this to happen at such an early age. So this was around when I was 21, I guess. So that's when he told my parents and he referred me to Dr. Sushant. So that's when we first went to the doctor. Positive factor was slightly low. It was just slightly positive. He prescribed some medications for a week and I was completely okay. The symptoms had completely gone and that was a sign of relief for me. I was actually off medications for at least 1 year and that was really a good thing for me, and that's when I went back to dancing again. So that's again when the pain started coming back again. I had to visit my doc again. The pain kept aggravating, sadly, but again I had to restrict dancing, I had to restrict overexertion at that point of time. But right now, thankfully, the condition is really under control. I can walk, I can do normal activities. However, I need to be careful. Like doctor mentioned, I need to stay away from smoke and overexertion. So that's something I always take care about. And yeah, I am pretty compliant as of now. I'm a pharmacy student, so I know what's really important to be compliant. So I have been compliant all these days.
Have you stopped dancing?
I did not stop dancing.
That's what I wanted to know.
No, I will never stop dancing for sure.
I love
However, I will be careful always to not overexert.
I mean, you should know at what
the
point
limits. Yes, exactly.
It's overexertion versus you can continue.
Yes.
And that you're the best judge, right,
yes,
by now.
Exactly.
But I'm so happy that you didn't let the paranoia and negativity stop you from doing something you really love.
Yes.
So to me, that thing says it all.
Yes, definitely. So yeah, I'm leading a normal life, and hopefully my medicines will taper down eventually. Yeah. And let's hope for a positive life ahead.
Lovely. You already are leading one. I mean, just your smile, your body language, it's so brilliant.
Thank you.
Thank you so much, Rachita. Nisha, let's hear from you.
My story is similar. I had come in a wheelchair to sir.
How old were you?
And I was, I think
32,
2017, 17, 18, I was visited sir. I was in a wheelchair. And I had previously been operated also on my hip.
For what reason?
For the same, for RA. I got it at the age of 21. So the progression in my body was really fierce.
Okay.
The strength of the disease was really hit me hard. But what I found is with a combination of medicines, diet, mindset is what helped me tremendously.
Okay.
Yeah. So I am focusing on this. And that aspect of it. I got it at a very young age, and she did too.
Yes.
And at that age, when that hits you, you are lost. I felt like I was out of my body, and this was happening to somebody else. And to have some grounding there, maybe have a counseling session done. Maybe
that's important. The counseling and the support group.
The support group
is there a support group?
There isn't at all. Fortunately, I had access to it because I got into that line. I'm a special educator, and I had some psychology background, and my friends were psychologists, and counselors, so I had help.
But many probably don't seek it.
And I saw that when I had gone to other doctors and the patients that had come there. They were so, my heart went out to them, I wished that, I could say that it will be okay. I am also a dancer. I have done Bharatnatyam.
How wonderful.
I also haven't stopped dancing.
I love that handshake there.
It doesn't matter if I'm just sitting and just
grooving, people who love dancing.
I got goosebumps.
Oh, that's so sweet. That's so sweet. Are you married?
No, I am.
Did this come in the way of that?
Yes, it has.
So there are issues with societal acceptance.
Absolutely, yes.
And Nisha, what about I saw your fingers also.
Yeah, they are.
You face the deformity.
Yes.
How was that experience? I mean, did it really make you withdraw and then accept it?
Earlier, but
at what age did that happen?
This was early on. Like I said, the
onset was very strong.
Very strong, and I had certain really strong emotional things happening around that time too. My father passed away right before, as soon as I got it, a few months later, my father passed away. So it just went down the whole.
Right.
The health aspect was literally ignored also for like 6-7 months.
Right.
And that's when this developed. Yeah.
Does this come in the way of your normal lifestyle, and do you feel
it has,
to
but
some extent that you're held back?
It has, but I have adapted around it also. Yes.
I just love her. Love her, like she keeps saying, mindset.
It is.
And with that, I'd like to say that we heard such beautiful stories. We heard about these two women who discovered it in the prime of their life, in their 20s. Right? And they both love dancing, and they did not let anything come in the way of their beautiful smiles, and they're still dancing through life. But what is important is that we get educated, we help kill all this misinformation that exists around this condition, normalize it, talk more about it. That's important. Thank you very much.
ढूंढने है वो निकली तकदीर अपनी उजली इल्ली ने मन में ठाना है बन के उड़ना